Hi, my name is Letitia R. Underwood of Letitia R. Stewart Consulting, and I am a critical care nurse practitioner. The goal of my business is to empower nurse practitioners that are wanting to work within the ICU setting. So I am your Executive APP Empowerment Consultant. I'm a natural born leader, and I love to mentor those and advocate for those who may not know what they want to do, but to just really encourage you to hang in there and just find your niche. I'm a lover of growth, and I'm dedicated to leadership. So if you are a nurse practitioner that's interested in working in the acute care setting, I'm your chick. If you actually go to my profile, you'll see a link to a free template, and I actually have a full course on teachable.com to assist you in the first couple of weeks with working within the ICU. So check it out. I have a website at www.letitiarstewart.com, and that is where you can find more information on how to work with me. But today's What to Do Wednesday is about nausea and vomiting. So what do you do when the nurse comes to you at night or during the day and says, hey, my patient has nausea? What is your go-to? So, number one, you want to be sure of why your patient is having nausea. If this is a post-op patient, are they having nausea because of the anesthesia that they received? Or are they having nausea because they have a bowel obstruction? So make sure, no matter what, whenever you're getting ready to prescribe medications, you have to remember to ask the why. Why is my patient experiencing this symptom, whatever it may be? So, nausea and vomiting is today's topic. My go-to for nausea and vomiting is usually Zofran. I'm not getting paid by this company to talk to you about medications, but Zofran is usually what I start with, and the medication that I move to next is usually Phenergan. I asked several people around the country, and it seems like we're kind of on the same wavelength when it comes to that. There's another medication that pops in my head, which happens to be Reglan, which happens to be a good medication as well. But the most important thing that you must remember whenever it comes to specifically nausea and vomiting, you want to understand why. I'm trying to think of other reasons why. A patient could have gastritis, a patient could have food poisoning, a patient could be in diabetic ketoacidosis. But one of the big things that I see within the ICU setting is the fact that the patient has received some type of anesthesia and their system just didn't sit well with it. So just to wrap up things, don't forget to find out the why of why they are nauseous and vomiting. And last but not least, try and give them something and always reassess to make sure that it works. Thank you for following me, and please share with anybody that you think this information would be helpful for. Take care. Bye.